The chimes are signaling the beginning of session 4. Session 4, where we're now going to describe elements within and external to a business case. And then part 2 of this session, where they're going to explore breaking out into working groups. But first, I want to introduce Simon, a medical sociologist who's been working in healthcare and health professional education research since 2002. He comes to us from Canada via Australia, where he is currently the Director of Research within the Office of Continuing Professional Development at the University of Ottawa. Simon's going to offer remarks about a different outcome to a business case before becoming the moderator of the session with Andrew Spiegel, who will be discussing valuable non-monetary outcomes of CPD. Thanks, Simon.
Thanks very much for introducing me, Holly. Thanks very much for having me as well. So now for something a little different, as they would say in the Monty Python skits. I'm going to deliver a Canadian case study for you around putting a business case together around CPD in an Australian accent. So if anyone gets lost along the way, for any of those two reasons, just put your hand up and I'll try and clarify what I'm trying to talk about. But as you can guess from my background, I'm a non-clinician and also, in a sense, a non-educator. I'm a medical sociologist. So I tend to spend most of my time watching health professionals go about their work and trying to create education programs, trying to enact them, and so forth. So I have my perspective is a little different, not only because of where I'm from and my context, but because of my training. So when I thought about this business case idea, and I was asked to talk a little bit about it, naturally I thought about it in terms of a social engineering perspective. And a particular case came to mind in Canada that I was a participant in that I think you might find a little interesting in terms of how we tried to go about putting a business case together and the unfortunate result of it. So next slide. So the case study is about a CPD consortium in Ontario, Canada. It's not a research-based discussion that I'm going to have here, but it's simply my perspective as a participant and as a sociologist experiencing and observing this. I will talk a little bit about the result and the lessons learned, I think. So next slide. So what we have, to give you the context, so it's in Canada, it's a universal healthcare system. CPD offices, continuing professional development offices, are based within the universities, within this particular province of Ontario, which is where I am. They are not for profit, but they are cost recovery. So they're a private sector, a public sector institution, that they work in quasi-private sector ways in terms of having to balance the books and run a business within a university setting. So it's an interesting place to be. So the history of the CPD offices is that the Ministry of Health itself was throwing out most of its money for education, for healthcare professionals, to the hospitals directly. There had been no pre-existing relationship between the Ministry of Health of the Ontario province and these CPD offices within Ontario. And so what we wanted to do was to try and get a united front together and approach the Ministry of Health and negotiate, put forward a business plan, a business case to the ministry for redirecting funding that historically had been going to the hospitals for education and bring it to us, based on the principle that we felt that we were the experts in education, hospitals are the experts in carrying out clinical kind of work. So interestingly enough, the ministry at that point, this was 2 or 3 years ago, had no idea what continuing professional development was. It was a completely new concept to them, and they had no idea what we were up to in terms of our activities across the province. So these CPD officers could be carrying out multiple programs, multiple CPD activities. So this is not one small kind of learning activity, one kind of intervention. They're in the business of rolling out multiple programs to multiple clients. So the next slide. So these were the goals of our consortium idea: to create a provincial consortium for the development, implementation and evaluation of quality continuing education for the health professions, and to enhance distribution of key messaging for public sector funded continuing health professions education. So we've been moving, as the States has, very much more closely toward quality improvement, and we wanted to get involved in the rollout of those kinds of programs and so on. So this was one way that we could see ourselves marrying our interests with the ministry, who are also interested in enhancing quality improvement processes, particularly amongst physicians within the province. Next slide. So these are the participants. There were, 6 of us. 6 medical schools were chosen to participate in the province. They constitute all the medical schools in the province. I think we have 17 across the country. And the idea was to create this consortium where we could work together where historically we haven't. So what did we do? So this doesn't look much like a business case process. And now looking back on it, I have a better idea of why we chose this particular approach. Is anybody familiar with the walk in the woods? Yes, a couple of people are. So this is an interesting process. So it's very much an American process. It's a method for multi-dimensional problem solving that is geared towards reaching a deal with the necessary buy-in support. Key components include the identification of self-perceived needs, agreement of key interests, opinions on or options on getting those interests met and prioritised, and reaching agreement on options and developing a detailed plan on how you move forward to do all that. So this will be of interest to you, I'm sure. The name originates from a Cold War nuclear arms reduction negotiators in the US, where 2 negotiators literally went for a walk in the woods after reaching an impasse in the negotiations. During their walk, they developed a genuine understanding of the interests of each other's countries and were able to reach an agreement. Although this agreement was ultimately rejected by the United States and Soviet Union, their meeting came to symbolise the advantages of informal interpersonal bargaining and interest-based negotiation. So what I'm going to talk about is the use of a methodology that was built out of a failure, and show how we applied it and failed as well. And then talk a little bit about why that probably happened. So next slide, please. So getting the value proposition together amongst all of these officers was a pretty easy thing to do. And here you can see where the social good, collaboration and quality fits into these agreed upon shared beliefs. So one of the principles within a walk in the wood is, what are you trying to do? Are you trying to build a partnership which is long-term with another stakeholder or institution that is based on a shared value system, a shared belief system and shared goals? Or are you trying to create a conditional alliance which is purely built on, will this relationship meet my interests, my short-term interests? And it's usually, that kind of relationship is usually a lot shorter. So we felt that we were entering into a partnership with these other officers. And so this is the shared beliefs which we got to very, very quickly prior to even running the Walk in the Woods process. I won't read those out, but you can see that they look like reasonable value propositions for this field. So the next slide. So previous discussions continued via email and with representatives from each institution, and we came up with these potentially enlarged interests or shared interests. So we needed to get an oversight coordination models put together. Intellectual property was an issue that we needed to negotiate. Revenue sharing practices needed to be sorted out. Accreditation models needed to be standardised in a way that was acceptable to all. Implementation models were clearly a problem in terms of the geographic distance between the different offices and the needs they were serving locally. If you have a look at a map at some point of Canada, you'll notice that Ontario as a province is a massive province in and of itself. And ultimately research collaboration as well. We wanted to be able to collaborate looking at QI rollout programs and so on across the province. So we needed to get to a point where we could create a memorandum of agreement that covered these kinds of issues. What was the result? So we'd done all this work beforehand, briefing documents, we got the value propositions going, we got agreement on what we had to get agreement on and what we had to develop, and then we ran the Walk in the Woods, we had the Walk in the Woods day. So the first thing, key personnel didn't even turn up. So we lost 2 deans of CPD that didn't turn up on the day. Prior to that, we got those value propositions agreed to very, very quickly. And so I think where we got complacent was we got there's a confounding variable, I think, that maybe operates more in university and public sector places than private sector perhaps, but social desirability. The value propositions we put forward were pretty hard for anyone to reject. And so we got immediate responses saying, yes, we agree that we have to collaborate over the coordination of the models, the accreditation processes, et cetera, et cetera. It's a bit like, for those of you who work in interprofessionalism and you do your satisfaction surveys or the happy sheets, and everyone comes back and says interprofessionalism is good, we need to do more of it, et cetera, et cetera. And then you go in and do the participant observation work and you may see something else happening in the dynamics in a hospital setting or a community care setting. So social desirability kind of means that it's pretty hard when the value propositions are put forward to knock them back and save face in a public kind of way. So the alignment in terms of core beliefs about creating a consortium and where the enlarged interest lay was not there. Clearly they said that the people agreed that there was a direction to go in, but clearly that didn't necessarily hold to that. Also the local logistics and operations of each office. So having a public sector institution that rolls out continuing professional development that's based on a quasi-business model is a little problematic. It's difficult to operate in a private sector kind of way within this kind of setting, within Ontario at least. And so they were very, very focused in on the local operations and maintaining relationships with long-standing clients, if you like. And so these offices are not large necessarily business affairs with a huge amount of personnel involved in them. They're quite lean machines within a public sector situation. Also, one of the things we didn't take seriously, although we knew it was in the background, I think, is the history of the institutions, the relationships between them over decades, and the current political relationships that were being played out, not only at the Vice Dean of CPD level, but the Deans of Faculties of Medicine, where all of the officers were sitting. So there were lots of political issues there that we were simply just not aware of the nature of them. And clearly, this is not research-based and this is a perspective only, but there were factors behind attendance simply of the deans themselves that we were fully expecting to have a full cohort of people turn up in the day, and it didn't happen based on some of the predilections of the local political flavours at the time. So I think if we go to the next slide, I started to think about this process as a sociologist. And so what didn't I know about this process? Well, for the first thing I should acknowledge, we didn't have a expertise in building a business case or a business plan of the kind of nature that we're talking about this morning, which we would have benefited from. But in the same vein, we don't talk about money in the same way in the healthcare system and in the university system in Canada. So it's not as easily calculated as what it is here by the system that you sit within. And it's more about buckets of money moving around in places rather than being able to, I think, get the kind of detail, the fiscal detail that you're able to in a lot of your situations. So having said that, I think three things really affected us. Firstly, that we didn't really understand the history of the relationships between the key stakeholders. The culture of each region where the universities sit and how the officers behave was very, very different. They were driven by very, very different issues that were very local and were related to the way the healthcare system operated around them and the needs of the healthcare professionals in their immediate kind of environment. Also the structure. So running this kind of interesting private sector operation within a public sector institution raises tensions in and of itself. And in fact, as we were doing the walk in the woods, one of the CPD offices was closed down in the west coast of Canada, kind of under threat and not terribly viable within that public sector setting. So I think for me, if we were to have a look at it again, what really struck me this morning was what Elena was talking about with identifying organisational risk and feasibility and formulating tactics to mitigate those. So the question for me was, how would you go about that? How would you find out about the people that you want to work with. So if we were to go forward again, I would think less about the business case I was putting forward, because we put it forward quite a reasonable, logical proposition and way forward to getting agreement to work together. But we didn't spend a lot of time thinking, how well do we know our potential partners? And how could we find out more about them, what their concerns are, and where sticking points might be? And I think we kind of run roughshod over that process a little bit. So it's a small point, but I think it's a fundamental one. And I don't believe that an overly technical approach, which is important, the technical and instrumental approach of a methodology to create a business case is important. But these other issues too, this other kind of intelligence, if you like, seems to be fundamental as well. So I'll stop it there.